Is my screen visible?
Yes, it is.
Okay. So, I'm presenting the case of a 26-year-old male who's a follow-up case of biopsy-proven pulmonary synovial sarcoma post 3 cycles of chemotherapy. He presented to the ER with hemoptysis, 3 to 4 episodes in a single day, and the total amount was approximately 350 to 400 ml. That is massive hemoptysis. It was associated with chest pain and shortness of breath. The pulse rate was slightly elevated and the BP was slightly low, likely due to hemoptysis, and the SpO2 was also decreased. So this is the chest X-ray of the patient, where we can see a large soft tissue mass in the right upper and mid zone without any significant mediastinal shift or bony destruction. Subsequently, a CT angio was done. These are the CT angio images, arterial phase, where we can see this large soft tissue mass to be situated in the right upper lobe. This shows heterogeneous enhancement with central areas of low density, likely necrosis. We can see multiple intratumoral vessels which are ectatic and aneurysmal. Medially, the lesion is abutting the cardiomediastinal structures. It is causing mass effect on the on the trachea, right upper lobe bronchus, right main pulmonary artery, right superior pulmonary vein, and left atrium. However, no definite signs of frank invasion are seen. We can also see these dilated bronchial and intercostal arteries which are supplying the tumor. These are the representative axial and corneal images in which we can see the tumor to be situated in the right upper lobe. And in the lung window, we could not find any metastatic nodules in the right lower lobe or in the left lung. These are the MIP axial and corneal images in which we can see the ectatic aneurysmal vessels supplying the tumor and the dilated bronchial artery supplying the tumor. So on the basis of these findings and after multidisciplinary team meeting, plan of bronchial artery embolization was done with two objectives. First was to control the hemoptysis, the massive ongoing hemoptysis that was going on. And second was to decrease the overall vascularity of the tumor as much as possible because the patient was also planned for surgery. So these are the DSA images in which we can see, this is from the run from the right ICBT, in which we can see both the intercostal and bronchial components supplying the tumor with tumor blush and bronchopulmonary shunting, which was subsequently embolized, as we can see in this run. The tumor was also getting supply from the subclavian artery branches, like the lateral part of the tumor was getting supply from the lateral thoracic branches, and the superior part of the tumor was getting supply from the first and second intercostal arteries, which were also embolized. The tumor was also getting supply from the right bronchial and the fourth and fifth intercostal arteries on the right side, which were also embolized. As we can see in the pre and the post embolization images, we use PVA 300 to 500 micron particles for the embolization. So technical success was achieved in this patient as all the abnormal arteries which were supplying the tumor were embolized. The CBT, the intercostals and the subclavian branches like lateral thoracic all were embolized. And clinical success was also achieved as there were no episodes of hemoptysis post procedure. And we hope that when the patient is planned for surgery next week, there is a minimal blood loss and has a better surgical outcome because of the bronchial artery embolization. So coming to the discussion part. So why does hemoptysis occur in malignancy? In malignancy, there is local tissue hypoxia, which leads to angiogenic growth factors production. That leads to neovascularization in bronchial artery. These new vessels have thin and friable wall, which is vulnerable to rupture and pseudoaneurysm formation, and which in turn leads to hemoptysis. Approximately 10 to 30% of patients with primary lung cancer develop hemoptysis during the clinical course of the disease, and 10 to 20% of these cases manifest as massive hemoptysis. Abnormal angiographic findings that we see in these cases are tumor blush, hypertrophy and tortuosity, bronchopulmonary shunt, and pseudoaneurysm, all of which were seen in our case. And in some cases, we can also see contrast extravasation. Embolization for hemoptysis in primary lung cancer. So this is a JVIR article from 2019 in which they took 84 patients for the study with primary lung cancer who had hemoptysis, either mild, moderate, or massive hemoptysis. They were able to achieve technical success after bronchial artery embolization in 98.8% of the patients, and clinical success was achieved in 82.1% patients. They used PVA particles, gel foam, and gel foam plus microcoils as the embolizing agents. And they concluded that BAE is a hemoptysis in malignant cancers. This is another article from 2015, bronchial artery embolization for malignant hemoptysis. They took 26 patients in this study, and technical success was achieved in 77% of the patients, and clinical success was achieved in 75% of the patients. And we could not find any article in which literature in which they had done BA in malignant hemoptysis in sarcoma patients. But we concluded that BA is a safe and effective approach for the management of hemoptysis associated with primary lung cancer, as it gives survival benefit. It increases the overall quality of life of the patient. And in cases when the patient is planned for surgery, like in our case, it would lead to decrease in the overall vascularity of the tumor, which would in turn lead to a better surgical outcome. Thank you.
Yeah, thank you. Does anyone has any question for Abhishek? Okay, Abhishek, what was the histology in your case?
Sir, a synovial sarcoma was seen on histopathology. It was present, immunohistochemistry. It was present positive.
Okay.
Yes,
So
sir.
it was a primary synovial sarcoma of the lung, or it was metastasized from somewhere else?
No. So this was primary synovial sarcoma of the lung only, sir.
Okay. And so, when this case got discussed in MDT, was any role for neoadjuvant chemotherapy discussed? Because that seemed to be a very large mass.
Yes, sir. 3 cycles. Patient already had undergone 3 cycles of chemotherapy, sir.
Okay.
Before he presented with hemoptysis.
Okay.
Isofosfamide and doxorubicin.
Okay. Thank you. It was a good presentation. Yeah.
Thank you, sir.